The body donation program at USD has records that date back to the 40s and 50s. The importance of working with an actual donor for our students can't really be described. If they were only given the opportunity to learn from technology or a book, I mean, human beings are so unique and so different that working with a donor really highlights that and really gives them something tangible, something that they can remember and recall routinely. As of this year, is really struggling with donations this year. We do have some qualifications that we have, and that's based off of height and weight, and that's at time of passing, because we understand that people's weight can fluctuate greatly in their lives. When it comes to other things, if there's been trauma to the donor, we would not be able to accept if the family members or friends are adamantly against donation. It's not in our best interest or of the loved one's best interest to cause any more grief during a really hard time. So those are some of the reasons that we would not accept a donation. If someone becomes a vital organ or tissue donor after passing, they would not be eligible for our program. However, that doesn't mean if you don't have a gallbladder or you don't have your kidneys because you gave it to your brother to make his life better, that we wouldn't be able to accept those. So if a donor is on the fence about donating to our program because they have to register with our program prior to passing, I just send them the student reflections of how important their first patient is to them and how pivotal that person is to their education. I share that with that person so they really know how important this gift is. If you're curious, if you have questions or concerns, or you're even on the fence thinking this might be an option for you, give me a call. Ask those questions. We're more than happy to see if this program's for you or not for you. And then you can make the most informed decision based on that. If it's not for you, it's not. But if it's an opportunity, you're going to be glad that you asked, because you're going to have a huge impact on the future healthcare of the region.